So the decision to go to Newfoundland with your new bride, in a sense, you had hoped to go still further abroad, China and India. Couldn't
That
go
is correct,
there.
yes.
And so you decide to go to Newfoundland. Did you know much about the Grenfell mission and what you were getting into?
Well, I knew a little bit because I had spent one summer there as a volunteer, as without pay or anything. I just did that because I'd learned about Sir Wilfrid Grenfell from the late Dr. DeFries, who would talk to Christian medical students in his home. Each year he would alternate between talking about Sir William Osler or Sir Wilfrid Grenfell, and so that I learned a lot about those two individuals, and they became, in a sense, role models for me. Dr. Grenfell, Sir Wilfrid Grenfell, had come over from England and founded the mission in 1875, and he died in 1940, so I never did meet him. But when I went there was Dr. Curtis, who was a senior person. He had succeeded Sir Wilfrid Grenfell, and Dr. Gordon Thomas, a younger surgeon, and myself, looking after all the people of Labrador and all the people of that northern arm of Newfoundland. So we were very busy.
And you were located
in St. Anthony, which is at the northern tip of Newfoundland. Mm-hmm. And I had to learn very, very quickly about surgery, about internal medicine, about obstetrics, and about pediatrics, about everything. We just had to do everything. And I had gone there originally to spend just 1 year while waiting to start on the galley training program in surgery in Toronto. But at the end of the first year, Dr. Gordon Thomas, the junior person, decided he was going to take a sabbatical leave and learn more about chest surgery because we had such a large number of patients with tuberculosis. And so Dr. Curtis then asked me if I would stay an additional year and do all the surgery and all the obstetrics and everything else. And that was a big responsibility. I was only 24 at that time. I was just a year out of a junior internship. And the 1 year that we'd had at the Grenfell Mission Hospital. But I felt I wasn't really qualified enough to do that, but Dr. Curtis said, I'm a pretty good judge of people, and I think you can do it, and I want you to do it, and I'll be around if you need any help. But as it turned out, he was quite elderly, and he just wasn't around, and I could go and talk to him about things, but he didn't come into the operating room and help or anything. I had to learn to do a lot of that on my own. We had a good library, and I became quite an independent thinker because of that, and that had a signal effect on my whole career, I think, taking on a large responsibility at an early age.
That kind of responsibility, even hardened doctors, when they look back on it, surely will admit that it must have been terrifying at times.
It was terrifying at times, but I always believed in preparation for any type of surgery that I was going to be doing. I read about it and studied it, and we had an autopsy room where I would sometimes do surgery in the autopsy room to feel confident when I started to do it for the first time with a patient. It was not exactly terrifying. It was certainly stimulating.
Primitive conditions?
The conditions of living in northern Newfoundland at that time were primitive. There were no roads, there were no railroads. Aircraft were just starting to be used. We had to drive dog teams in the winter to go and see patients, and in the summer we went by open boats along the coast. So that was quite primitive.
And I understand you flourished driving dog teams.
Well, most of the doctors over the years apparently had just stayed on the Comatic or the sled and let the professional driver do the driving. But I was intrigued by the way they drove the dog teams. And on the western side of Canada, the driver stands up at the back of the sleigh and cracks a whip. But in Newfoundland and Labrador, you kneel at the front of the Comatic, as it's called, and you scoot with one leg. And it's really hard physical work, so I would always share that with the professional driver and take equal time driving and give him a rest. And the local people were always intrigued that a person who was a doctor could actually learn to drive a dog team.